Hello, I'm Dr. Satyashri, pulmonologist from Vizag. Today I have taken the topic of common cold and cough. This is very common, that's why I have chosen. This is the most common complaint and most neglected. And cough and running nose happens in all age groups. So, but still it's most neglected and because of that, because this common cold and cough, first of all, will be treated by home remedies, and then second thing, then going to nearest medical shops and taking lots of cough syrups or antihistaminics. Third thing is that still taking old prescription and again taking every time repeating the same prescription for cough and cold. So why I'm giving emphasis on this problem? Because if you keep it persistent, it will cause lung damage. If anybody who is suffering from common cold and cough, suppose if gets you will become all right within 3 to 5 days, fine. No need to consult anybody. It's absolutely okay because your immune system is taking care of it. But if it keeps on recurring or persisting, that means it's damaging your lungs permanently. And because our nature has provided many protective mechanisms, uh, like cilia, mucus, and all these things to take out the bad things out of the lungs, to push the bad things out of the lungs. But if repeatedly it happens, this is going to damage the lungs permanently. Okay. Yeah. How actually it damages the lungs? Because most common even in cold also, people who are having chronic rhinitis, they'll develop post-nasal drips, means always that sputum is going down the trachea into the lungs. That is called post-nasal drip. So it gets settled in the lungs. So whenever, apart from the air, if sputum is there, like you can see in these bubbles, they are too delicate. They get damaged. The walls are broken and it develops into a big cavity. Similarly, when there will be a fibrosis, like when we develop a wound, we can see the scar. So the working capacity of the lungs gets destroyed. Slowly they develop breathlessness also, and that is not good. That's the reason I say definitely you should consult the pulmonologist to know the reason for the cough and then treat accordingly. Because cough, as I said, between 3 to 5 days, if it dissipates, it's absolutely fine. But if still persists, expert opinion is needed and don't take it lightly. Now, what are the different common reasons for the cough? First, most common is viral infections followed by bacterial infections. And of course, many types of viruses are there, COVID, including COVID, influenza virus, parainfluenza virus. Similarly, throat infections, tonsillitis, adenoids, etc. Now, another common cause is allergies, where many people are allergic to so many substances in the air, pollution, dust, and then pollen grains, then certain food particles, paint, so many things, cigarette smoke, whatever it is, why one is getting cough, one should know it. Even including certain drugs can cause cough. Other most common is the TB and of course lung cancer, because all these problems needs to be diagnosed properly and treated properly. Another common problem is again heart problem. Though old people, those who had some heart dysfunction post myocardial infarction, they will also develop heart congestion. Fluid gets accumulated in that, and because of that, they'll also get continuous nagging cough. So this is another reason. And then interstitial lung disorders, people working in factories and paper factories, sugarcane or cement factories, they will also have cough as well as lung damage. So the reason can be very well diagnosed by pulmonologist and hence treated accordingly. Just don't take it lightly. It's only cough. Anyway, nothing will happen. Slowly they will damage your lungs and then they'll lead into breathlessness and nothing can be done. If the lungs are gone, means gone except lung replacement. And it happens over a period of time. So please don't neglect it and get treatment properly. Thank you.